All right, today we're going to dive into a really important topic in men's health, prostate cancer. We're going to walk through the entire modern journey, from how we find it to how we treat it. And then we'll zoom out and look at a core skill for any radiologist, how they figure out what's going on when they see any kind of spot on a bone. So let's get right into it.
1 in 8. Just let that sink in for a second. That is the lifetime risk for a man developing prostate cancer. It's a huge number. But when a disease is this common, the real challenge isn't just about finding it.
It's figuring out which cancers are the aggressive ones that actually need treatment and which ones are so slow growing they might never cause any harm at all. And that's the big dilemma, right? How do you avoid all the stress and the side effects of overtreatment while still making sure you catch the dangerous cancers early?
So here's our roadmap for today. We're going to start with the old diagnostic problems, then see how new imaging has totally changed the game. We'll look at the treatment options and then explore what happens when the cancer spreads. Finally, we'll learn the basic principles radiologists use to read bone scans, which will bring everything full circle.
Okay, so let's start with the problem. For decades, the way we went about finding prostate cancer was, well, let's just say it was messy. The main tool we had was the PSA blood test, and honestly, it created just as many problems as it solved.
Yeah, the PSA test is just notoriously unreliable. It's got a super high rate of false positives, which leads to a ton of anxiety and a whole bunch of invasive procedures that might not have been necessary. And even worse, it led to the over-diagnosis of these indolent or non-aggressive cancers. This meant tons of men were going through treatments with some pretty life-altering side effects for a disease that probably would have never bothered them.
But that was the old way. Today, we're in a completely new era, and it's almost all thanks to one amazing piece of technology, the multiparametric MRI, or MP-MRI. It has absolutely revolutionized how we find and assess prostate cancer.
And with this new tool, we get a new language. Radiologists now use a scoring system called PI-RADS. The easiest way to think about it is like a threat level assessment on a scale of 1 to 5. It's basically a standardized report card that tells doctors exactly how suspicious a spot looks, making sure everyone is speaking the same language.
So here's how that score breaks down. A PRADS 1 is totally normal, a 2 is low suspicion. 3 is the gray zone. It could be inflammation or it could be cancer. But PRADS 4 and 5, those are the red flags. They signal a really high chance of a significant cancer. And the score is based on a couple of key visual clues. First, cancer cells are packed really tightly, which restricts how water moves around them. That's a sign we call restricted diffusion. Second, the area just looks dark and abnormal on a specific MRI view called a T2 image. The more those signs show up, the higher the score. Simple as that.
So what's the real-world impact of all this? It's huge. A major study called the Precision Trial found that by using MRI first, a full 28% of men were able to avoid an invasive biopsy altogether. That is a massive improvement, cutting down on so much anxiety and so many unnecessary procedures.
And this chart shows the win-win perfectly. The MRI approach means fewer biopsies overall, which is great. But here's the really amazing part. It actually increases how often we find the clinically significant cancers, the aggressive ones. So we're doing fewer procedures, but we're better at finding the cancers that actually matter. It's a total game changer.
Now, this new level of diagnostic clarity means we can be so much smarter about treatment. Instead of this one-size-fits-all approach, doctors can now confidently recommend anything from just keeping a close eye on the cancer to using some seriously advanced radiotherapy.
So you've got two main paths, active surveillance and active treatment. For a lot of younger guys with low-risk, non-aggressive disease, active surveillance is actually the best option. You avoid all the side effects of treatment for a cancer that isn't an immediate threat. But of course, for higher-risk cancer, you go with active treatment like surgery or radiation. The point is, now we can make that choice with real confidence.
And when treatment is needed, modern radiotherapy is incredibly precise. These advanced techniques basically sculpt thousands of tiny radiation beams to perfectly match the shape of the prostate. And to make sure they're hitting the exact right spot every single time, they do a quick CT scan right before each treatment. This daily image guidance lets them shrink the treatment area and dramatically reduce any damage to the nearby bladder and rectum.
Now, this is a crucial point. Both surgery and radiotherapy are equally effective at curing prostate cancer. So the decision really comes down to the side effects. As you can see here, surgery carries a higher risk of things like incontinence and erectile dysfunction. Radiotherapy can cause some bowel issues. And brachytherapy, that's where they put tiny radioactive seeds right inside the prostate, has fewer of those issues but has its own set of risks. It's really a personal decision, based on what's most important to the patient.
Okay, let's pivot now. What happens when prostate cancer isn't caught early and it spreads outside the prostate gland? This is where our story shifts from the prostate itself to the #1 place it likes to go, the bones.
Prostate cancer is what's called osteotropic, which is just a fancy word that means it loves bone. The cancer cells are drawn to areas with a lot of red marrow, like your spine, your pelvis, and your ribs. In fact, some studies have shown that up to 70% of men with advanced prostate cancer have bone metastases.
And these metastases have a very specific look. They're usually osteoblastic, which means they actually stimulate new bone to form. So on an X-ray or CT scan, they show up as these dense, white, sclerotic patches. This is really different from a lot of other cancers that create lytic lesions, which eat away at the bone and look like dark holes.
So this brings us to a much broader topic, a really fundamental skill. How does a radiologist look at any spot they find on a bone and figure out what's going on? Well, it's definitely not guesswork. There's a systematic process, a kind of checklist they go through every single time.
And here it is, the 6-point checklist. They look at the size, the exact location, and how sharp the borders are. They analyze the pattern of any bone destruction. They look for a reaction from the periosteum, that's the bone's outer layer, and, really important, they check if the cortex, the outer shell, is broken. Every one of these points is another clue in the puzzle.
So let's see this checklist in action with a classic example of a benign or harmless bone tumor, the osteoid osteoma. Clinically, this thing has a dead giveaway, a deep, aching pain at night that almost magically goes away with aspirin. On the scan, the signs are what we call pathognomic, basically unmistakable. You see this small, dark center called the nidus. Now, if we apply our checklist, the margins are super well defined, and it's surrounded by this thick, white halo of reactive bone. The cortex is totally intact, and there's no aggressive reaction on the bone surface. Every single sign here points to a slow-growing, benign process. It's the total opposite of something nasty like an osteosarcoma, which would have messy margins, a crazy sunburst reaction, and a busted cortex.
So let's bring this all back together. From what's happening inside the prostate to what's happening in the bones, there's one common theme that keeps popping up: the power of advanced imaging to give us real clarity.
And this is exactly why that systematic approach to bone lesions is so incredibly important. I mean, this quote says it all. Metastatic tumors are the most common things a radiologist is going to find in bone, especially in older adults. So knowing how to tell a metastasis apart from a primary bone tumor or a benign spot is just a critical skill across all of cancer care.
We've seen how clearer MRIs of the prostate led to fewer biopsies and way better treatment decisions. We've seen how a systematic reading of a CT scan can confidently nail down the diagnosis of a bone lesion. The main takeaway is this: clarity changes outcomes. And so the question I want to leave you with is, as our imaging tools get even more powerful, even more precise, how is that going to continue to reshape not just our diagnoses, but the entire future of how we treat cancer?